Is your past two tests. It'll be 50 questions. It's not a lot of content, as you guys know. It's only been 2 weeks, so that's good. I'll present with a PowerPoint. You can ask questions as we go along. You don't have to be on camera. I will be on camera and I'm recording this. I will send it to your professors and let them know who was here. And um, any questions before I start? I'm like 2 minutes early, but I'm going to start anyway. No? Okay. Here we go. All right, so like I said, it's the PowerPoint. Let's see here. Where is it? Here we go. All right. So we start with postpartum. We start with after delivery. That's what we're going to start with, and then we'll discuss newborns and stuff like that. So think about after delivery. What are we looking for? We're looking for bacterial infection in the cavity that often occurs during labor. What I told my class, and I want you guys to remember this, think about anybody who has an infection. So we're going to look for mom. We're going to look for a fever. We're going to look for tenderness, odor, all those kind of things, right? Because that's important when we're thinking about an infection on mom. What do? Give them antibiotics, okay? Postpartum infection, endometriitis is the most common infection of the lining of the uterus. Prophylactic antibiotics with a C-section you will always give, and remember that. We look at their surgical incisions, any lacerations, UTI, mastitis, remember, is our infection of the breast. That's you're going to see fever, you're going to see warmth and redness on the breast, flu-like symptoms. What do? We make sure they continue pumping, warm compresses, and antibiotics. Okay, so make sure you're remembering that as you go along. Postpartum hemorrhage is possible. There's a lot of blood. There's double the amount of blood while pregnant. So postpartum, you're going to have that come out. So you're going to watch for hemorrhaging. 500 cc's or more is going to be a hemorrhage. Here's your lacerations. This picture right here is swelling at the vaginal area. That can happen from too much pressure on the baby's head, from the baby's head there. We see hematomas and we let the provider know, as always. Urinary is when the uterus doesn't contract. So what do we want to do? We want to make sure we massage that fundus. We can give Methergine, Hemabate, or misoprostol, which is Cytotec. We give that. Prevent bladder distension. If you have the uterus displaced to the left or to the right, we're going to catheterize them, make sure that they are voiding well. Okay. Let's see what else. Hemorrhagic shock. It's going to be like any shock that you get, cool, clammy, hypotension, and fast pulse, right? Because you have bleeding going on. So we maintain our O2 sats, assess their neurological, breath sounds, blood volume, tissue perfusion. We have lines going for them. Oops. And make sure that we medically manage that. ITP, another coag problem that comes post-pregnancy. That's going to be when they don't clot. So anti-clotting disorder, you're going to have low platelets, increased bleeding times, and severe hemorrhage. Okay, so medical management, same thing, platelet stability and treat with corticosteroids, and a platelet infusion sometimes is necessary. We have several different mood disorders that come about. We have the baby blues, which is going to be from like day 5 to day 10. We have postpartum depression, which is going to be intense and persuasive sadness, severe mood swings, lasting more than 2 weeks. Rarely will go away without some help. Gradual improvement over 6 months. We recommend psychotherapy, antidepressants. Psychosis is going to be psychosis like if it were with any patient. You're going to see some really bizarre behaviors. Suicide risk is up and they will hurt their babies. So those stories that we hear on the news, that's going to be like psychosis. When we're looking at our babies, we're giving them APGAR scores. Remember, the max you can get is 10. You'll barely ever get a 10 because babies are usually blue in the feet and on their hands. So this is our APGAR. So we look at their appearance. What's their color? How's their pulse? Do they make a grimace? Do they cough, sneeze, anything like that? Activity, are they moving? Are they just laying there? And respiration. When you have an APGAR lower than 7, you should really be concerned. Please know, and I think one of the questions on there is they will give you signs of the baby and you need to give an APGAR score. So remember, max of 10, and so somewhere in between 0 and 10, depending on what the baby's doing. We have a case study here. We're gonna, oh, that's a long case study, huh? All right, newborn care. So remember, we're gonna worry about the heat on the baby. So we're gonna vigorously dry them so they're not sitting in wetness. Suction the mouth, nose, M before N. Why do you think you do the mouth and then the nose? Anybody?
Because they'll suck in the stuff if you do the nose first, right?
Yeah, it'll go back into the mouth, right?
Mhm.
So you want to get that mouth clean and then the nose. So M before N. Respiratory distress or heart rate less than 100. You will have a doctor in the delivery room with you, but you do need to notify somebody. You'll do an APGAR score 1 in 5 minutes. If it's poor, they'll do another one at 10. Skin to skin is where you put the baby bear skin to the mom's bear skin. It helps with body temperature, promotes bonding, and breastfeed initiation. We do eye prophylaxis on every baby. It's really for gonorrhea and chlamydia, but it has become the standard for all babies. Vitamin K for their clotting. So we do this in the newborn nursery. All right, thermoregulation, thermogenesis, and cold stress. Cold stress will be on the test, so please pay attention for this. We're remembering that with thermoregulation, we have to try to keep them warm, really. Um, so we will see metabolic acidosis, we'll see
What did you say?
hypoglycemia, and we'll see anaerobic
We're really
glycosis.
quick.
So maintain the
Do
heat on them, dry, put them in a warmer, keep them warm. All right, GI. Let's see. Spitting up is oftentimes something that you'll see with the GI tract. If it's continuous, then you're going to have to assess what's going on there. Stools, we're looking for meconium and that transitional. Milk on 4 day, you'll get yellow, seedy stools with breastfeeding. We look at the respiratory distress, less than 30, greater than 60. Nasal flaring, they grunt, they make these noises like because they can't breathe. Hypotonia, central cyanosis, tachypnea can be a sign of inadequate fluid clearance. So on their C-section babies are going to have more fluid. Why do you think they have more fluid in their lungs? Why are C-section babies going to have more fluid?
Kind of a more traumatic experience during birth. It's not like a normal way of going down the birth canal, so maybe they swallow more
They
fluid.
don't get squeezed from going out of the birth canal.
Right. They don't, the fluid doesn't get squeezed out, right? Because they're just being pulled out. So that's really why you'll see that. Bilirubin excretion, we've talked about this. There's a picture here that you can look at. They look yellowish. It's usually excreted in the feces, so feed every 2 to 3 hours. If they are yellow skin and eyes, then you're going to put them under lights. There's several reasons for it, so just keep that in mind. We look at our skeletal and peripheral nervous system. So sometimes if they have a shoulder dystocia, you'll see brachial plexus injury. Erb's palsy is our most common. That's when the arm is not going to move the way it should. So it'll kind of just lay there when you look at them. Clavicle fracture, not uncommon. You'll hear it cracking. So remember that. The newborn head, there's going to be molding because it's come through a vaginal canal. So it's soft. Remember, they have their fontanelles, right? And so the fontanelles give a little room for that skull to come down the vaginal canal. So if they're depressed, okay, or indented, we worry about dehydration. And if they're bulging, it means it's too much. Something's too full in there. So we think about intracranial pressure. All right, so a caput edematous area over the scalp. It's a normal finding, remember, because their heads have been squished out. Cephala hematoma is going to be a collection of a blood. Know that this will not cross the suture lines, so we're going to have an increased risk of hyperbilirubinemia as well. Okay, so see the difference here? This big lump on the side, it's gonna not cross your suture lines. Newborn reflexes, there's many different ones. There's rooting, there's Babinski, there's the suck and root, there's the startle where you startle them and they'll jump. Babinski is when you swipe the bottom of the foot, it'll fan out like a fan. Those are all normal findings, okay? Their skin, you're gonna have cyanosis on the feet. Usually, if you look in this picture right here, this is a great picture. That's what is normal findings, but the rest of the body is pink. Mongolian spots, there's a nice picture here as well. Those are the bluish, blackish spots. It's here underneath here, I think. Right here's our Mongolian spots, right? They're the bluish black pigmentation. They're most common on dark skin, Latin American, African, Mediterranean. Looks like bruising, but it's not. They'll have fine hair on their body, so that is kind of how they keep themselves warm. And so that you're going to see. Newborn problems, we have bunches of them. So we're going to take a look at some of them. Know this fact, please. Know that if they have hypospadias, their circumcision is contraindicated. So remember that. If you see either of those factors, the foreskin, we need to use to repair, so we're not going to do a circumcision. Torsion is going to be blue discoloration of the scrotum, accumulation of fluid around the testes. We see that with the light. Reproductive, with our girls, we're going to see swelling, sometimes vaginal discharge. It's due to the increased estrogen in pregnancy. So that's something we have to keep an eye on. All right, at 24 hours of age, baby Alice is noticed to be jittery and feels cool to the touch. The nurse notes she is LGA, has not breastfed for 6 hours, and is not being supplemented with formula. What should the assessment finding prompt the nurse to follow up with? She's jittery. What are we thinking? She's jittery and
Blood
LGA.
glucose?
What?
Blood glucose?
Good. Low glucose. So what are we going to do? Check the glucose level. What kind of intervention should we think about for this baby? What kind of interventions are we going to do for a baby with low glucose?
You need to feed them.
Mm-hmm. Exactly. You have to feed them. Get their sugars back up. If they're not willing to breastfeed, what are we going to do then?
Do glucose gel or formula?
Yeah, you're not going to usually do glucose gel on a baby. You're going to do formula. If you have to supplement, because they won't breastfeed. You know, they need to be eating and drinking and pooping and peeing. That's what we remember. All right, so when we're discharging those babies home, we're telling them make sure that we watch their temperature, take their temp, and respirations. We're going to tell them that it's possible that baby's going to have lapses where it doesn't breathe. That's okay, as long as it stimulates its breathing on its own. Feeding patterns, we do on demand for breastfeeding as needed. For formula, you're going to give them hourly, usually every 3 to 4 hours. We need 6 to 8 wet diapers a day. We want to tell them how to sleep. How are they going to sleep?
Why is that? Why do you feed like more with the bottle versus with the breast?
Well, it's not that you feed more, but with breast milk, you're going to feed on demand. So you set their schedule. When they're hungry, they'll tell you, and so they'll breastfeed. If you're giving formula, you have to sort of tell them, okay, it's time to eat. So same kind of thing, but with breastfeeding, you should be feeding every like 2 hours. You know, because the baby needs 6 to 8 wet diapers a day. Does that make sense?
Yes, thank you.
Mm-hmm. How are they sleeping? On their belly or on their back?
On their backs.
Back.
On their backs. What do we not put in the crib?
Pillows, stuffed animals, blankets.
Excellent. Anything that would go over their nose, because they're not going to know how to pick their heads up yet. Car seat safety, you can have them go to the fire department, have them check how it's installed, make sure that they're in there. Non-nutritive sucking, so like pacifiers, thumb sucking, we know prevents SIDS. So they're not bad. So if the baby wants that, then that's a good thing to do because it stimulates their breathing, their sucking, okay? Cord care, keep it dry, it'll fall off. CPR, you want to teach them how to do CPR on the babies. This week we did drug exposed infants. Remember, we have opioids and illicit substances will cross the placenta and breast milk. Methadone is acceptable with breastfeeding as long as we're not using anything else. Please know methadone is not contraindicated in breastfeeding. Degree of how the infant withdraws is really going to be related to what drug was used and how often. So we assess for signs of withdrawal. What are some signs of withdrawal?
Loud crying, not being able to be calm.
Good.
Hyperactivity.
Yawning.
Good. All those. Yeah, excellent. Don't forget you're watching for seizures too. And we give morphine to prevent those seizures, right? So here's the things we're going to see. It's all throughout the body. You're going to see it all throughout the body. So neurologically, we'll have those high cries, irritability, tremors, yawning, sneezing. GI, you're going to have bad sucking, poor feeding. Metabolic, you're going to be sweating, temperature instability. So what do? We hold them tight, we swaddle snugly, and we decrease stimuli. What's that care called? It's an animal that encourages skin to skin with the
Kangaroo.
mom. Good, kangaroo care. All right, our pretermers, those are those who are born before 37 weeks. They have immaturity of many organ systems. They're at high risk for infection. They're more susceptible to low blood sugars and to that increase in bilirubin. So we can give surfactant, but at to 35 weeks is when it should be developed. So the greater the degree of immaturity is the greater the degree of disability. So you see a lot of those preemies have things long term. Mag sulfate can be given preterm to help with that immaturity. All right, our diabetic moms, remember those babies are going to be full of sugar. So they're going to be bigger babies. Macrosomia is at about 90%. So they're going to have increased risk for birth injuries. What kind of birth injuries are they going to be increased if they're macrosomic?
Super chubby, big heads.
Right, big heads. Good. What else is going to be big that gets stuck and broken?
Shoulder
Shoulder
dystocia.
Good. Shoulder dystocia, right? They're at higher risk for respiratory distress because of the insulin production. The increase in insulin reduces the surfactant for lung development. All right, so then we have some hormones that are released with breastfeeding. So prolactin prepares the breast to secrete milk. Oop, 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 oop. That went too fast. And then oxytocin we know is going to be essential for that milk ejection reflex, that letdown. Okay, it decreases the risk of postpartum hemorrhage because it contracts the uterus. So we recognize feeding cues. Don't wait until the baby is crying. So what kind of cues do you think you're going to see?
turning their head when you touch your cheek.
Good. Yep. What else? They're going to be irritable, maybe like they want something, they're hungry. So, we're going to make sure they have a good latch. We can see them swallow. And there's several different positions you can hold them in. You can see them all here. There's a football. Let me move this. There's all different kinds, right? You can hold them like this. You can hold them like up here. We have all the different ones. So you hold them like a football. Here's the football hold. Here's across the lap where they go across that way. You can do cradling, which is that way, or you can do side lying where they lay next to you. What's the worry with side lying now? Anybody know?
Falling asleep and rolling over on them.
Exactly. They're going to fall asleep because they're laying down. So I don't like to encourage that, but if that's what you have to do, that's what you have to do. All right, for breastfeeding moms, we're going to add 450 to 500 calories a day. Well-balanced diet. Don't put anything on the breast, no cream, no lotion. Not considered effective method of birth control. Breastfeeding is not a form of birth control. A lot of people think it is, but it is not. Medications, we have to see what passes through the breast milk and make sure that we can identify that. If they're not breastfed, infants must receive iron fortified formula. No rigid feeding schedule, like you don't feed on demand. Feed every 3 to 4 hours. 6 to 8 feeding. So that 6 to 8 pops up again. What's the other 6 to 8 thing?
Diapers, wet diapers.
Excellent. Wet diapers, 6 to 8. Infant should be held for feeding and burp the infant several times to decrease the air that gets in their bellies, right? For spitting up. All right, math. Let's see. We're not going to do math because it's confusing. All right, the nurse assisted with the birth of a newborn. Which nursing action is most effective in preventing heat loss by evaporation? Put your answers in the chat for this one. Remember evaporation. All right, everybody's saying 3. Somebody who said 3, why is it 3? Why is drying with a towel going to help with evaporation?
Just like when we get out of the shower, we want to dry off. Otherwise, we're kind of like still moist and soggy.
Excellent. And you're going to get cold. Do you ever get out of the shower? I always wanted a heated bathroom floor and never could afford it, but I always wanted that because you get really cold. So those babies are going to get cold. So you want to keep them, dry them off. It's very important. A nurse in a neonatal unit receives a call to prepare for admission of a 43-weeker. What is that? 43 weeks. Is that full preterm, post-term, or on time?
Post. Cooked too long.
Yeah, cooked too long. Score of 1. So that means they only did one thing on that APGAR score, and 4. What is the nurse's highest priority? Answer this one in the chat. Put your answers in the chat for me. APGAR 1 and 4. Remember that. Let's see what you guys picked. Oh, everybody picked. Oh, most of you guys picked 2. Somebody picked. Yeah, 2. 2. All right. So, alrighty. So our answer is going to be 2, right? And that is going to be this baby is suffering. So heart rate is probably low. Oxygen is probably low. Movement is probably low. So all these things, we need to have that oxygen ready to supplement that baby. Okay. So we can get that feeling better. So highest priority for a newborn with a low app score is always airway. Remember ABCs, the airway, breathing and circulation. They're important, but they're lower. The newborn would be placed on an apnea and a cardiac monitor, of course. We're going to do an IV, but that's not going to be our priority. Airway is always your priority. All right, nurse in a newborn nursery is monitoring a preterm newborn for RDS. Which assessment findings should alert the possibility of this syndrome? Think about its breathing. And it's a select all that apply, I can tell you that. And we got 1, 2, 4, 5, 1, 2, 4, 5, 1, 2, 3, 4. 1, 4, 5. 1, 2, 4, 5 again. Okay. So someone who picked the right answer, which is 1, 2, 4, and 5, tell me why you're worrying about those 4 things. 1, 2, 4, and 5. Cyanosis, tachypnea, retractions, and grunts.
To be honest, I read it that those were all the symptoms.
Yeah, those are all things of somebody who's not breathing right. Hypotension has nothing to do with breathing, does it? Last time I checked, our blood pressure doesn't have anything to do with breathing. And presence of a barrel chest, that you got more problems than respiratory distress. Okay. The nurse administers erythromycin to the eyes of a newborn, and the mother asks the nurse, why is this performed? What explanation is best to provide? What is it that we're really trying to fight? And all babies usually get this, just so you know. We got 3, we got 4. Remember, it's always going to be 4. Why is it 4 and not 3? What is
You're trying to
erythromycin treat for?
prevent the spread of an infection during delivery.
Nope, so it's always gonorrhea. That's what we're worried about. So it's 4. That's why you use the erythromycin. Okay, if mom has, we treat it to all babies just to make sure in case there's an undiagnosed case. Okay, and so we know gonorrhea is the reason we put that cream on their eyes. Any questions on that one? All right, remember that's what its use is. Postpartum nurse is providing instructions to the mother of a newborn with hyperbilirubin, so jaundice, who's being breastfed. The nurse should provide which instruction? Remember, how do we get rid of that jaundice? See what are our answers here? Ooh, everybody likes 2. Somebody tell me why 2 is the right answer.
You want the baby to continue to poop to get rid of the jaundice.
Exactly. And you're not going to tell them to switch to bottle feeding. That doesn't do anything. We want them to just poop it out. So you continue the breastfeeding because that's best for the baby so that they can poop more to get rid of the hyperbilirubin, right? So early and frequent feedings help the excretion. So breastfeeding within 2 hours after birth and every 2 to 3 hours. Okay, so switching to bottle feeding for 2 weeks is definitely not necessary. Nurse is performing APGAR scoring for a newborn immediately after birth. Notes that the heart rate is less than 100. Respiratory effort is irregular. Muscle tone shows extreme flexion. Grimaces when suctioned. And the skin color indicates some cyanosis. What should the immediate nursing intervention be? All right, everybody's saying oxygen supplementation when suctioning. And why would that be the reason? Why would you do that?
Is it for safety and airway?
Yeah, and our respiratory effort's irregular, right? So our muscle tone is fine. And we're grimacing, so that's good. We have a little cyanosis on the feet. That's okay. So we look at those criteria. You're going to need to know this, okay? So heart rate is absent, it gets a 0. Less than 100, you get an APGAR of 1. Greater than 100, which is normal, is 2. Respiratory effort, again, if you have nothing, it's 0. Slow or irregular is 1. 2 is a good loud cry. Muscle tone, you want some extremity flexion. We'll give you a 1. Active moving, 2. And then our grimacing, coughing, sneezing, crying, cyanotic, you're going to see feet that are. Okay. So scores of less than 5 indicate the newborn is having difficulty. And so you may need CPR when you're at that 5. Often when you're 5 to 7, you just need supplementation. The nurse is caring for a term newborn. Which assessment finding should alert the nurse to suspect the potential for jaundice? It's only one thing here. All right, everybody's going for 1, and I agree, it's 1. Why is it 1?
So lack of blood flow, isn't it? Because it's all pooled on the head in that bubble.
All right, so you have that bubble on the head, right? It's an enclosed hemorrhage, right? So it's going to be jaundice because we have an increased bilirubin as it tries to solve that lump that's on the head. Birth weight is 8 pounds 6 ounces, so that's normal. Negative direct Coombs has nothing to do with it. It has to do with maternal antibodies. All right, the mother of a preterm is comparing the appearance of her preterm baby to the nearly full-term ones. She asks why the skin looks so different. What is the best response for the nurse to provide? All right, everybody's going for 2. That skin's going to be more translucent or see-through, right? Because they don't have as much fat on those babies. So that's why the skin of a pretermer is going to be very thin, and you're going to see lower amounts of fat on those preemies. Okay. So we worry about their heat and how they stay warm. Small for gestational age newborn immediately after admission to the nursery. What should the nurse monitor for an SGA? Remember, they're small. Nope, we're all over here. 3 and 2. That's what we're thinking. 3 and 2. So bilirubin and blood glucose. Why are we worried about hypoglycemia? Why do we think the little ones might have low sugars? Because they're little, they're skinny, they don't have enough storage in them, right? So that's what we think of. LGA, we should know this one. That's a big baby. What should we assess for evidence of birth trauma? All right, everybody's on board. Number 1, why is number 1 correct? The clavicles.
Because of what is it? Shoulder dystocia.
Excellent. Their shoulders get stuck because they're so big, right? All right, and this one. All right, nurses preparing to care for a newborn with RDS. Which initial action should the nurse plan to best facilitate bonding? Remember, they're on RDS, so they're on that oxygen and all that stuff that's got to help. All right, everybody thinks encourage the parents to touch the newborn. And I would say you are correct. Why is that? What does touching have to do?
Like, isn't the point of bonding skin to skin?
Exactly. You want them touching each other and that skin to skin and being touch is always an identifiable thing that'll bond two people together. The nurse is teaching a postpartum client about breastfeeding. Which instruction should the nurse include?
Oh, oh no.
You don't know?
Okay.
Well,
1.
should we use soap?
Yes.
No. We
No.
don't use soap or lotion.
No.
We know that breastfeeding is not a birth control measure, so we're left with these 2. What do you think? What do you guys think? Let's see what you picked. Everybody picked 1. Why'd you pick 1? Why'd you guys pick 1? You're right.
Because mom's losing fluids like via milk, so she needs to replenish them.
Yeah, so it's her bodily fluids are decreasing, so she can become very dehydrated. Prenatal vitamins are good to take. Soap should never be used because it increases the chance of cracking, and you don't want cracking. That's very painful. Okay, and it's definitely not a method of contraception.
So you don't like wash them in the shower?
You let water run on them. That's it. Okay. And there's nothing dirty about them because most breasts are covered or underneath clothing, right? So even if you're in the shower, I mean, I don't know about you guys, but even if you're not breastfeeding, you're not scrubbing dubs on them, right? So, and if you're a boy, you definitely don't do that. Well, maybe you would. I don't know. Visit a mom at home 24 to 48 hours after discharge. What should the nurse expect to note in a healthy mother who's breastfeeding? There's two signs we know breastfeeding is successful. Think about that when you're looking at these answers. All right, Hattie, why'd you pick 4? You're right, but why'd you pick 4? All right, anybody, if Hattie doesn't want to answer.
Because of
anybody-
the position,
Sure.
because the baby's facing the mom.
Okay, but what do you see in that answer that you know is positive feeding? There's 2 signs of positive feeding on breastfeeding. What is it?
Sucking and
Sucking and swallowing.
Excellent. Sucking and swallowing. And so there you see it's sucking and swallowing. Okay.
Couldn't get my mic on fast enough.
Okay. All right, I think that's it. Yep. Oh, we have one more. On assessment, a newborn is exhibiting cyanosis, tachypnea, nasal flaring, and grunting. RDS is diagnosed and the primary care provider prescribes surfactant replacement therapy. What way do we give this? I know we spoke about this in my class, but I didn't emphasize it too much, but you need to know this. Surfactant is always given the same way. Oh, good. You guys knew it anyway. It's always through an ET tube. Okay, that's how it's given. The aim of therapy is to support the disease until it runs its course. Surfactant will help with those lungs. Okay, so the only way you administer it is through an ET tube. Okay, that's our 15 questions. Any questions for you guys on the test? There was a lot of content, like I said, but in a 2 weeks period. So hopefully it's stuck in your head a little bit. Was there anything I didn't go over that you guys would like me to go over? Do we feel like we're going to ace the test? Yes, yes, yes. All right, I will post this review for your teachers. I will mark that you were in attendance. I also would like you to make sure that you attend other reviews because that's always helpful. Okay. If I have no questions, then I will say good night to everyone. And I'm available if you need tutoring, just contact me directly.
Thank
Take it
you.
easy. You're welcome.
Thank you.
You're welcome. You're welcome.